Okay, moving along. We ended off, I think, the last recording with K0040, adjustable ankle foot plate. This is for a patient who does not have full range of motion in their ankles and therefore require to angle the foot plate either plantar flexion or dorsiflexion. What you want to do is when you give the patient a wheelchair, you want to make sure that their toes and heels are flat on the footrest. And if the patient has drop foot or plantar flexed, you want to bend the foot plates slightly downward. This will accommodate the patient's range of motion in their ankle and give them a full surface support from heel to toe. E2601 is a standard seat cushion, and E2611 is a standard back cushion. Every patient beneficiary that gets inside a chair is entitled to a seat cushion and a back cushion for comfort. These are standard generic seat cushions. Just because the patient has a wheelchair, they are entitled to this cushion. Items less common, we have the E2605 to E2608. So E2605, 06, 07, 08, and then E2622, 23, 24, 25 as well. These are upgraded seat cushions, which we will get to know in the next section about coding for seat cushions, what they mean. E2613 to E2621 is upgraded back supports. These back supports and seat cushions are diagnostic driven. Until now, we did not require anything that was diagnosis driven. We mentioned in previous slides, a patient's unable to walk, they get a wheelchair. They can't weight shift, they'll get a tilt and space seating system. They require armrests, anti-tippers, pneumatic tires. This is based on a patient's limitation and physical conditions. When it comes to seat cushions, if the patient requires posture support or pressure relieving, these items require the patient to have a qualifying diagnosis. This is a Medicare requirement that in order for a patient to qualify, even though the justification may not be for the diagnosis, for example, if a patient requires, let's say, a contoured back to maintain their trunk at a more upright position, they have a poor core, they have, impaired trunk control. If the patient had a stroke, if they have hemiplegia, they would qualify for the contoured back. If they're hemiparesis, they would not qualify for the contoured back. Now, both patients had a stroke, and the stroke is what caused them to have impaired trunk control. They have a generalized weakness. They both require the contoured back. One has a diagnosis that qualifies, one does not. Another example would be dementia versus Alzheimer's. A patient requires a contoured seat or back for patient's leaning over to the right. They want to put a lateral support on. If the patient has dementia, they will not qualify for the lateral support. If they have Alzheimer's, they would qualify. E1225 is manual recline. The idea that the seat can recline backwards. When we talk about recline, we're referring to only the backrest being affected, meaning the seat pan or the seat cushion stays in its position, and then you can recline the back down. The patient now can lay down. That's an extra feature on a wheelchair. It could be on a K5, it could be on a K3, it could be on an E1161 tilt and space. Arm trough E2209, that's if the patient, one of their arms, they have less motor planning or strength to move it around and it falls off the armrest. You want to make sure you're giving them a trough where they kind of gives them more stability. That's called an arm trough. It's an extra item. E1028, these are brackets. Anytime we have to add like lateral supports, medial thigh supports, thigh guides, a headrest, an arm trough, swing away joysticks, there's something called the E1028. This is a swing away or removable bracket. So it's really a hardware for brackets. Scenario, we're putting it next to the arm trough, you'll have an E1028 next to it. E0953 are the thigh guides. Those are the outside guides that help the patient's feet stay straight. If the patient is abducted, their feet splay open, you want to make sure you're putting thigh guides on the sides to kind of get their lower extremities at neutral so their feet go straight down as well. Their positioning is much better. They're going to, every E0953, how do you attach it to the wheelchair? With the E1028 hardware for thigh guide. E0956, this is for a lateral trunk support. This is along the trunk, thoracic or lumbar. It's coded E0956. Again, you will need the E1028. Now, what happens is if you need it on both sides, they come in a pair. So the E0956, you do times 2, E1028 times 2. You can just write X2 on their detailed product description. E2208, O2 cylinder tank carrier. This is for a patient that is O2 dependent, requires to have the O2 with them in their wheelchair. That's an add-on accessory, has its own code. E0950 is anterior trunk support. This is not a seatbelt. Seatbelt, we said before, is E0978. Going to be a across the chest or trunk support, something additional. E0957 is medial thigh support. E2203, seat depth equal or greater to 21, or E2231 is a solid C-pan. Now, E2203 can also be E2304. Depending on the seat depth, again, always a good idea to get your quotes in first so we know exactly how it's coded, what the seat depth is, if it's E2203 or 04. The deeper than 20 inches, there's an upcharge from the manufacturer, and therefore it is another reimbursable item. We get paid separately. We're going to Medicare and saying, hey, this patient has an upper leg length of 23 inches. We want to make sure the patient can have increased support and fit properly in their chair, increased pressure distribution. What we're going to do is we're going to get them in a deeper seat. Because we get a deeper seat, it costs us more. We get paid back differently. We have to get that item coded. E2231 is a solid C-pan. This is a feature that can go onto a K5, where basically the patient may or may not be able to fold their chair. They have removable solid C-pans, but what it does is that it eliminates the hammocking effect. When a patient sits in a standard wheelchair with a sling seat, it kind of has that hammock effect where they slouch in it and they slouch down. Some may want a solid C-pan. You may want to recommend it in different scenarios. There are benefits and setbacks with having a solid C-pan. It's heavier. It doesn't fold as easily, even if you have a removable one. The benefits would be that you got better pressure distribution, especially if you're putting on if you're going to put on a molded seat, then you probably want to put a solid C-pan on that as well, so the mold stays and does not get caught up in the hammocking effect.